Hello, and welcome. Today, we'll be exploring a complex and challenging heart condition, single ventricle defects. These are congenital heart defects, meaning they're present at birth, where a baby's heart has only one functional pumping chamber instead of the usual two. We'll delve into what causes these defects, how they affect the body, and the treatment options available to help these little hearts beat stronger. The exact cause of single ventricle defects is often unknown. In most cases, it's believed to be a combination of genetic and environmental factors. Some studies suggest a link to chromosomal abnormalities like trisomy 13 or trisomy 18, but these are rare. Exposure to certain medications or infections during pregnancy may also play a role, but more research is needed to understand these links fully. Ultimately, it's important to remember that parents usually have done nothing to cause this condition. Normally, the heart has two ventricles, the left, which pumps oxygen, rich blood to the body, and the right, which pumps oxygen, poor blood to the lungs. In a single ventricle defect, one of these ventricles is underdeveloped or missing, leaving only one functional chamber to handle both tasks. This means that oxygen, rich in oxygen, poor blood mix within the single ventricle. The heart then pumps this mixed blood to both the lungs and the body, resulting in lower than normal oxygen levels in the bloodstream. This inefficient circulation puts a significant strain on the heart, lungs, and other organs. Single ventricle defects are relatively rare, occurring in approximately 5 out of every 100,000 live births. While the exact incidence can vary slightly depending on the region and study, they represent a significant portion of severe congenital heart defects requiring intervention in infancy. The signs and symptoms of a single ventricle defect can vary depending on the specific type and severity of the condition. However, some common indicators include cyanosis, a bluish tint to the skin, lips, and nails, caused by low oxygen levels. Babies may also experience rapid breathing, difficulty feeding, poor weight gain, excessive sweating, and fatigue. In more severe cases, heart failure can develop, leading to fluid buildup in the lungs and other tissues. Diagnosis of a single ventricle defect typically begins with a physical examination where a doctor might hear a heart murmur. If a defect is suspected, further testing is necessary. An echocardiogram, which uses sound waves to create images of the heart, is the primary diagnostic tool. It allows doctors to visualize the structure of the heart and assess its function. Other tests, such as an electrocardiogram (ECG) to measure the heart's electrical activity, a chest X-ray to assess the size and shape of the heart and lungs, and cardiac catheterization to directly measure pressures and oxygen levels within the heart, may also be used to provide a more complete picture. Single ventricle defects encompass a spectrum of specific anomalies. Some common types include hypoplastic left heart syndrome (ALCHS), where the left side of the heart is severely underdeveloped, tricuspid atresia, where the tricuspid valve, which separates the right atrium from the right ventricle, is missing, pulmonary atresia with ventricular septal defect (VSD), where the pulmonary valve is blocked and there is a hole between the ventricles, and double outlet right ventricle (DURV), where both the aorta and pulmonary artery arise from the right ventricle. Each type presents its own unique challenges and requires a tailored approach to treatment. Treatment for single ventricle defects is complex and typically involves a series of staged surgeries. The goal of these surgeries is to improve blood flow to the lungs and body and eventually separate the systemic and pulmonary circulations as much as possible. The first surgery, often the Norwood procedure, is usually performed within the first few days or weeks of life. This is followed by the Glenn shunt at a few months of age and the Fontan procedure typically between 18 months and 3 years of age. The Fontan procedure redirects blood from the lower body directly to the lungs, bypassing the heart. In addition to surgery, medications such as diuretics, ACE inhibitors, and digoxin may be used to manage heart failure symptoms. Some patients may eventually require a heart transplant. Unfortunately, there's currently no known way to prevent single ventricle defects. Because the causes are largely unknown and often multifactorial, prevention is challenging. However, women planning to become pregnant can take steps to optimize their health, such as taking folic acid supplements and avoiding smoking and alcohol consumption. Genetic counseling may be recommended for families with a history of congenital heart defects. The prognosis for children with single ventricle defects has improved significantly over the past few decades, thanks to advances in surgical techniques and medical management. However, it remains a serious condition with lifelong implications. Many patients require ongoing medical care, including regular check-ups with a cardiologist, medications, and lifestyle modifications. Long-term complications can include heart failure, arrhythmias, and thromboembolic events. Research continues to focus on improving surgical outcomes, developing new medications, and understanding the long-term effects of these procedures. Scientists are also exploring regenerative medicine approaches to potentially repair or replace damaged heart tissue. The ultimate goal is to improve the quality of life and longevity for individuals living with single ventricle defects.